And as usual on this time on a Monday, time to join Anneliese Giselle from the Health Hub store in Ballincollig. Good afternoon to you, Anneliese.
Good afternoon, John Paul.
And a lot of questions in, and I'll go straight to them. And first of all, Anneliese, this is from Jerry, who was in Glanmire. And Jerry wants to know, what is a good vitamin to take in winter to stop sore throats? Because Jerry regularly gets and suffers from sore throats in the autumn and winter months. So any advice there for Jerry?
Well, I think generally if you're a good eater, I'm not a big fan of taking multivitamin supplements, John Paul. I much prefer to take kind of directed supplements. So in the winter time, if you're good for eating your fruit and veg, you won't need a multi. So just take something very specific for the immune system. Elderberry complex is a big favourite in this shop here. We do one by a company called BioNutri. And in there, you've got your vitamin D, your vitamin C, and your zinc. So they are the absolute basics to support your immune system. But this is also lysine, which is antiviral, beta-glucans, which are brilliant for the kind of first line of defence, and elderberry extract, which is another lovely antiviral, and a few small other bits. So we would always get feedback on this, that people, when they take it, they get far less coughs and colds, and even if they do get a sniffle, it tends to clear up pretty quickly. So something like that elderberry complex is a brilliant all-rounder to support the immune system. Are any of those ingredients in it? If you can't get that particular one, they also do one for kids, by the way, which is chewable. And then specifically for sore throat, what I would recommend is the Dr. Clare throat spray. So this has got echinacea in it, as well as some marshmallow and some sage. So the marshmallow is lovely and soothing for kind of sore, inflamed mucous membranes. And the echinacea is a great immune support and a great one again for antiviral. So it'll prevent the sore throat getting worse or getting infected, or it'll help deal with the virus. And the sage do the same thing. So I would use that throat spray for this gentleman probably every day, really. But it is a great one. I always take a bottle of it on the plane with me, John Paul, because it's such a great one for the immune system as well. And it's always the case, isn't it, that you either get a cold going on your holidays or coming home for your holidays.
Yeah.
So I find that taking that prevents it. And then in the winter, if I go to any event, like if I was to go to the cinema, or if I go to a concert or anything where there's loads of people coughing, I take it with me and I use it then as well. And that definitely gives you an extra protective edge.
Well, hopefully that helps you there, Jerry, on that, and you won't be getting those sore throats this winter. Best of luck to you there in Glanmire. Now, Anneliese, this person wants to know, do you have to take a supplement or enzyme if your gallbladder is out, she says. The doctor says you don't, and they're confused.
Okay, well, the doctor is right and he's wrong. So he's right in the sense that not everybody may need to take a digestive enzyme. But actually, in my experience, people who, when they've lost their gallbladder, they do struggle to digest particularly fats. And taking a digestive enzyme with a main meal or with a meal that would have fat in it will really cut down on their symptoms. But actually, once your gallbladder is taken out, your body does compensate. So the gallbladder really acts as a little storage or reservoir for all of your bile, and that helps break down fat, and then all of the enzymes as well that help digest fat. So by taking something with a little bit of ox bile in it and the fat digesting enzymes, it can really help until your body compensates for the lack of the storage. Instead, you'll get more of a drip coming into the digestive system as opposed to a big flush that you would have got from the storage. Another great thing to take as well, John Paul, is something called lecithin, which is brilliant as well for skin and mucous membranes. It's very high in phospholipids, and a lot of people would know it for reducing cholesterol. But really how it works is it helps your body to make bile. You can just add it into your breakfast cereal, and that's how it reduces cholesterol, because bile is very important for making sure you bind old cholesterol and get it out of the body. So I would certainly suggest using the lecithin, and then just keep a fat digesting enzyme on hand for maybe you might go out or you might like to have dessert with cream. And the best one that we've found is the BioCare artichoke and lipase complex.
Hopefully that helps that person there. Now, Marie has been on, Anneliese. She wants to know if there's any solution for cutta in the throat. This is the build-up of mucus, isn't it?
Yes, that's right. It's mucus in the throat. There's a couple of different solutions for that, John Paul, but unfortunately a lot of them really are only, having the sort of the dealing with the symptom effect as opposed to fixing the problem. So it's often good to figure out really why are you producing so much mucus. Is it coming down from your nose? So is it a postnasal drip for sinus? There can be a big link with stomach acid sometimes as well. A lot of people have a weakened valve at the top of the stomach. It's supposed to shut very, very tightly. But caffeine and smoking and alcohol and certain diets will make that valve a lot weaker. So people will get acid fumes coming up, and then to compensate and protect the esophagus, the body will make a lot more mucus. So if you could figure out, if you think it's coming down from your sinus, that's one thing, and if it's coming up from your stomach, that's the second. So in terms of managing it, Dr. Dealish Clare does a lovely congestion blend that helps to dry up mucus. So that would be particularly good for those people who feel it's coming down post-nasal drip from the sinus. And then if you think it's coming up from the stomach, the best thing to do is to take something that will tighten up that little valve. Zinc carnosine, Carnozin, is very good for that. You'd need to take it for a couple of months, and then you'd probably get a couple of months and it's great for anybody with heartburn as well, John Paul. And then you could probably give it a couple of months break. You might need to take it a couple of times a year, every now and then.
Mary is in Charleville. Will stay on sinuses because she suffers from her sinus sometimes. But recently she's had an unpleasant smell in her nose and she has used a sinus rinse, but it only helped a little.
Okay, now that's an interesting one because, again, it's difficult to know whether or not it's coming down from the sinus or whether if it's having a bad taste. It's possible that it's coming up from the stomach, because that would be one question I'd ask people in the shop if we were trying to figure it out is, would you ever wake up in the morning with a sore throat, and would you have a bad taste in your mouth? And if so, it can be coming from the stomach. But if that bad taste is coming down from the sinus, there is maybe some kind of bacterial thing going on there. One of the things you could do for that is you could do a steam inhalation. So you get a big bowl of water and put in some oregano drops. Oregano is really, really potent antifungal and antibacterial. So put a few drops of that oregano oil into the bowl of water and then towel over the head and do that inhalation in through the nose. And if there's anything up there that shouldn't be, it should kill off that. It's a great one as well for preventing sinus infection in the winter time if you're prone to getting those.
And this is something that I've heard a lot of people say to me over the last number of weeks. I thought it was the full moon first, but I don't think it is because that's long gone. And this is from Roy Croft, who's in Rosscarbery. He says he can't sleep. He's tried sleeping tablets from the doctor. He then tried Nitol. Can you recommend anything for him, Anneliese?
Yeah, we've lots of different supplements for sleep, and they don't work by knocking you out. So what they do is they work by helping the stress hormones to reduce in the system, and then for the hormones and the neurotransmitters that are important to keep us calm and get us to sleep, it helps to promote those. So it's a very gentle, natural way of getting to sleep, and that's a good thing in that it doesn't make you feel groggy in the morning, but it doesn't always work for people. But the one that we get the best feedback on is the NHP Advanced Sleep Support. That works very, very well. But a lot of people just take something called magnesium bisglycinate. So the glycine is very important for the neurotransmitter that helps get us to sleep, and the magnesium is very good for the busy body, busy brain as well. So that would be probably the most basic one to try first. And I always think try the best one first, because if that doesn't work, it's unlikely the others will. But if the best one does work, you can always move on to the cheaper, less complicated version like the magnesium bisglycinate.
Okay, hopefully that helps you there, Roycroft in Rosscarbery. Kate was in hospital in June and she contacted C. diff. Now she is still not feeling 100%, not interested in food whatsoever. She's currently taking Simprove, but what else can she do or take to help her feel much better?
So there's definitely, in this case, like the Simprove is very good, but I think always in terms of probiotics, it's good to cycle them around, John Paul, because they all have different strains of bacteria, and then some of them, even the bacteria, even if they have the similar strain, they can be different genetic types. So I always think it's like planting seeds in your garden. If you just keep planting the same red dahlias, that's all that's going to grow. So I think the first thing to do is probably cycle your probiotic. And the ones, we have a fantastic one here that we've been getting great feedback on, and it's the Nature's Plus Women's Probiotic, and it's a little bit pricey, but we've been getting amazing feedback on it for stomach problems, for kidney problems, as a thrush preventative as well. And then it's always worth taking something like a digestive enzyme that just helps you break your food down a little bit better. So that means that that the sort of the indigestion and the bloating and all of that would be less, and the food is broken down to a better stage, which actually is very important for feeding good bacteria as well. So I would recommend cycling your probiotic and taking a digestive enzyme.
And Liz would like to know, why is she picking up COVID so much? She's got it 3 times already this year. Now, she doesn't go out that much, but is it because possibly she's run down? She does take a zinc vitamin. So any advice for Liz?
Yeah, it's a difficult one really to know, John Paul, because some people get COVID a lot and then some people don't seem to get it, or even if they do, their symptoms are very, very minimal. So I just think it's like every other virus. You have to support your immune system. And without a doubt, there's numerous studies that show that people who have a low vitamin D status are not only more likely to get COVID, but their symptoms are more likely to be severe and they're more likely to end up in hospital. So there's plenty of research on that. So I think the best thing to do is actually get your vitamin D levels checked. Some people need a lot more vitamin D than others, and I'm not a great fan of taking a high dose of vitamin D unless you need it, because it does increase calcium absorption, which could increase your hardening of plaque around the arteries. So it's good to know exactly how much vitamin D you need to take, and for that you have to get tested. So that would be the first thing I would recommend there, because that's the most likely. And then take a good immune support. So the elderberry complex that I spoke of earlier, that is an excellent all-arounder, and it's got vitamin D in there with zinc and lots of other things. So I think that would be a good one. And then I would have something in preparation in case you felt yourself sickening. So I find that the Dr. Claire tinctures are wonderful. She's got one that you all use there, John Paul. I know it tastes disgusting, the Mucotone, but it works brilliantly. That's a great one, not only just to support the immune system, but if you've respiratory symptoms. She also does an immune boost one, and I always have those in the medicine cupboard. And as soon as I feel a slight headache or a sniffle and I know something's coming on, I start on them immediately. And generally, it gives your immune system the ability to catch it before the viral load kicks in, and that you'll actually start getting major symptoms. So that's what I would recommend there, is to have something like that in preparation as well.
Okay, and I've only 2 minutes left, so we'll get through as many questions as we can. Okay. First of all, Kathleen, she wants to know the best cure for piles. She currently uses Annusol. If you have any advice for Kathleen.
Okay, so the first thing is make sure that you're having a gentle daily bowel movement. So add some psyllium husk to your breakfast cereal in the morning, at least 1 tablespoon, and drink a pint of water with it. And the Dr. Claire Witch Hazel Cream is a good alternative to the Annusol, and it works brilliantly.
And Eileen, even, hopefully that works for you, Kathleen. Eileen has a trapped nerve. Now, she has been onto her doctor 3 times. It's still troubling her. How long should it take usually to clear, and any advice on what may release this trapped nerve for her?
Very hard, John Paul, because it can be anything down to collapsing discs, bulging discs, inflamed discs, bone issues. And I think there's nothing you can take to prevent it or help it. So I think you need to go and see a physical therapist or a chiropractor or an osteopath or somebody who can help with spinal realignment and get that nerve released that way. And sometimes if it's down in the bottom of the back and if it's resulting in sciatica pain in the leg, getting an injection into the piriformis muscle of the buttock works very well. You can ask your GP about that.
And another person here asking, what can they take for arthritis, because they're on aspirin and cholesterol tablets?
Okay, so that's a hard one, because if you're on a blood thinner, it can make a difference to what you can take. But the ones we get the best feedback on are the GAL UC2 cartilage, and that would be suitable. And the other one is the One Nutrition Joint Factors. There's a tiny little bit of turmeric in it, but it shouldn't cause a problem with aspirin. I wouldn't take it with a full blood thinner, but aspirin it would be okay. So either of those, they're the 2 that we get the best feedback on all the time. And
very finally, we mentioned sinuses earlier. Kathy wants to know, is there anything you can recommend for blocked sinuses?
So the blocked sinuses, well, the sinus rinse that somebody was doing earlier, that works very, very well. So you get a little pot, you fill it with saline, and you do a sinus rinse. We find that the Dr. Claire congestion blend is very good for helping reduce the amount of mucus, and that can help. And then in terms of a nasal spray, there's a lot of natural nasal sprays on the market. One of the ones that worked the best that we used to get great feedback on is called X-Clear, X and then CLEAR. And that seemed to work fantastic for people as an alternative to the steroid nasal spray.
Very good, Anneliese. Thank you for that reminder of information as always, and we'll chat to you next week.
Thanks, John Paul.
Take care.
Bye-bye.
Anneliese Giselle there joining us from the Health Hub based in Ballincollig. You can also find out more information on the helphubstore.com. She'll put up the information of all the products she mentioned today, and you can listen back on c103.ie or indeed the C103 app.